hey guys, Dr. Anderson here, and I'm here with James and Terry. They came from Indiana, and actually did a Zoom meeting with him. It's very funny in his
Car.
SUV. It's kind of unique, but he has a unique story. He came here with some chronic pain. A lot of times you would call this reflex sympathetic dystrophy or complex regional pain syndrome, but he had pain resulting from a foot surgery that he had back in Indiana, and nobody seemed to be able to help with it. And he's about 48 hours out, and his pain's pretty much eliminated. I think he's kind of doubtful about it because it's just too much for him to believe right now. Terry believes, but I don't know if he believes yet that this could be it, the end of the story for him. So maybe just share your story with people really quick, because other people out there might be able to relate to this.
Well, I've had 6 foot surgeries.
Okay.
I broke my foot cleaning my boat.
Oh, okay.
I twisted it, my right foot. And my left toe crossed my other one. So I said, well, I'm getting foot surgery. I'll just have them do that one too. That was 2019. And ever since then, I've had a pain right in between the toes.
Point down there. It's just kind of just on the top. And this is a very small area compared to some people. Some people could be big area, small.
I've always said it's just like somebody driving a railroad spike through it.
Mm-hmm.
I've got, I need shoulder surgery. I've got arthritis. I don't have any cartilage in my shoulders. I tore a bicep tendon in the bone. But what's hurt me the most is that right there.
Yeah.
And today it doesn't.
Yeah, nice.
I am very happy, extremely happy.
So what was it like with him? I mean, last couple of days, because
Well, before he would, when he had the pain, he would go to bed and he would hit his foot against the mattress and just jerk and just try to get some other feeling other than the pain.
Right.
And the past couple of nights, he
just nothing.
No pain, other than the incision site, but no pain there.
Right. And speaking of, the incision is very small. It's probably about 2 finger widths. There's a little pad underneath this. It's white. It's about that long. And he just needs to keep that dry for about 3 weeks, and he'll be able to walk here very shortly. But that's pretty much the layup. When people come in with this, just some basic principles is there are 4 nerves around the lower leg area that go down to the foot, but they do not supply muscles. So it's safe to remove any one of those branches. And when James came in, what we did is we can tell by where the pain is located which nerve is more likely to be contributing to the pain, right? So the surgery that he had down here probably damaged a branch, or a branch got scarred down, and that little branch was part of the bigger nerve up here called the deep perineal nerve. So we actually injected him up here, and by injecting the nerve, it numbed it up, obviously, and that mimics what it would be like if he didn't have a nerve. So that's how I call it nerve mapping. That's what we do when people come in. Sometimes we may try one nerve, they don't respond very much, and we have to try another nerve to see which one it is. But usually we get it right the first time because we know our anatomy, and that's my job.
Yeah.
Well, most of the foot surgeons I had gone to said, don't mess with it. There's nothing we can do.
And they probably even warned you, don't have surgery.
Yeah, don't. And I thought, I don't know. I know he had cut the tendon, but I thought he had severed a nerve.
Right.
And maybe they could do some kind of nerve surgery on it. And they said, no, you do not want to mess with that foot.
Exactly.
It'll make it worse.
Don't touch it, make it worse. And that's a common misconception that's out there. If you're hearing that, it's absolutely not true. In many cases, we don't need to worry about that, and it's something we've been doing here for many, many years. So the other thing that might have been done is, I don't know if they talked to you about nerve stimulators in your back. Some people have to look at that as an option, or also just being on narcotics, which is the other treatment route for people with chronic pain. So,
which weakens your kidneys after a period of time and makes you constipated.
So what compelled you to get here? I mean, was it just you kind of hit the bottom of the barrel there, or what?
I own bail bonding companies. I write people, and we chase them when they miss court. So looked up perennial nerves, looked up all the nerves.
All the nerves
of the
really?
foot
Okay.
and studied them, and you came up. You were number
Right.
one.
Well, thank you.
So,
And he said he just couldn't take it any longer.
Right.
yeah, I said I've had it.
Right.
Cut the foot off. I don't care. It really just hurt way too much.
Hopefully he'll be easier to be around now in your relationship. Not that he wasn't.
No, I can't
But
believe
also-
the pain's gone. That's just
Yeah,
amazing.
okay. And so I'll let you go. I mean, one thing he's going to be going through, hopefully 3 months from now he's going to be just like this. That's usually going to be the case, but probably for the next week or a few weeks, probably at night he'll be waiting for this thing to happen again, and eventually the brain will say, no, it isn't going to happen.
It's gone.
It's gone. It's absolutely gone, because right now I don't think he quite has the faith that
Well,
this
it's been
is
there
for good.
4 years or longer. So.
Right. So just have some faith, and it should be fine. Okay. And we will be in touch after you leave here
I
today.
want to
so,
really thank you.
Okay. Yeah.
I mean,
Yeah.
You guys have been
so
great.
Got him out of pain.
Okay.
Thank you.
Great. Okay.
Besides,
Appreciate it.
Great doctor. You're a great person.
Well, thanks. You too. You've been fun to work with, both of you. So that's it. Just know different approach to chronic pain that you could consider, and that's it. Please subscribe to our YouTube channel. Ask questions, make comments if you will, and share it with other people you might know that are suffering with this, and hopefully this spreads around the world and the country. We'll get more people off narcotics. It's really a bad thing. A lot of people are on narcotics for this chronic pain stuff, and they don't need to be in many cases. So thank you for watching.